Okay, well, thank you for coming. Yeah, I've got mic here. Everyone can hear me? So yes, I just want to thank you all for taking time out of your day, and we've got a pretty good schedule here. We got a lot of people presenting, but let me just first go ahead and show you our agenda. And if you'll take note on, we've got an extra one in here, rate analysis. So that was an extra one that we just based on some various feedback, we decided that we wanted to have some folks, well, we got a gal coming in to talk to us about all of that procedure and process. So just a note on that one. So this is just a little bit of my background. I've met a number of you, but yes, I'm originally from California, and I went to school in California. That was my dental program at UCSF. I worked in California for 6-7 years. I did a bunch of oral health research at various universities and at the federal level. And then I came to Texas to do my residency program here, and that was in dental public health, and then came over to Department of State Health Services, and now I'm over here. So just a little background there. So I'd like to just introduce a couple people here that I work closely with. Over here we have, I know he's standing over here, Dr. Charles Gray. So he's over at TMHP, the dental director. And then we also have Dr. Rhonda Stokely, and she's also with us here today. And so she's relatively new, so welcome to Dr. Stokely, and she's over there as our oral health program director. So I just wanted to just give a few goals that I have just basically come up with saying, you know, what am I doing here at HHSC? So, you know, I really just, there's a lot of players involved in the whole Medicaid program, and so that's just one of my things, is that I need to be that person to help coordinate those efforts amongst all these people, and you'll get to meet a number of them today. I definitely want to maintain some open communications with all of the various stakeholders, obviously why we're here today, and just basically looking at some of these things: operational issues, areas of abuse, utilization rates, trends, that kind of thing. And then basically looking at current policies, we're definitely going to do that, proposing, you know, if any revisions, basically in an effort to improve the program. So those are some goals. And then we'll just go into talking about just the meeting, obviously, here today. This is kind of like our big sort of kickoff. Hello, 2016. There's some new things going on. But I also wanted to basically work with some of the Department of State Health Services. We have reps out in the field, and I know that they like to do different workshops. And I said, hey, can we do some collaborative things? So we've got the folks out in Houston. They've got March 11th. I'll be going out there, and so it'll be a little bit more of a closer, intimate setting, one-on-one, a little bit more there in Houston. And then I also have one planned to go down to Laredo, and I'm hoping to maybe get a couple more during the year, but that's basically going forward in 2016. So